But we are making some bets that there's going to be a change in the way that we're going to be able to diagnose patients going forward. One of those examples is a partnership we have with OpenAI, where we had this hypothesis that we could actually extend our ability to diagnose rare conditions with large language models. So at Boston Children's, we run the Manton Center for Orphan and Rare Disease, where we see some of the rarest and most complex pediatric diseases on Earth. And we get families that come to us looking for answers. They're on diagnostic odysseys for years, maybe decades. Oftentimes we can solve those cases, but many times these families are left without answers. And so that population is a consented group of families that is open to thinking about new methods of diagnosis. And so we went to OpenAI with this idea of, well, what if we combine sort of our best-in-class genetics researchers? We have data on phenotype and very deep insights about the conditions these kids are experiencing. Plus, we have genome sequencing that includes variants of unknown significance. Our collective genetics group has not been able to solve patients, but for some they have. And so we initially gave OpenAI a collection of solved patients. The initial work with OpenAI was really only a 10% hit rate, but working together and improving the models, and this is now baked into GPT-5, we are able to re-diagnose 100% by just giving this data. The big test, though, is like, well, what if we give it unsolved cases? And so we've now given OpenAI, in our collaboration, these unsolved cases, phenotype plus genetic data, and they've now been able to solve dozens of cases, which is really exciting because what's happened is that we've been able to actually provide these families now with a diagnosis. In 15 cases, we've now provided these families with a diagnosis that we didn't detect before.